Hello all, I am Dr. Hema Vaithianathan, fertility consultant at Oasis Fertility, Chennai. So what is recurrent implantation failure? So when a couple is trying to achieve pregnancy and they are undergoing several attempts of IVF, and during that IVF cycle, when at least 3 good quality embryos are transferred and still the results are negative, then we can call the situation as a recurrent implantation failure problem. So it is a difficult problem. And what are the causes of this recurrent implantation failure? So there are a variety of reasons that can lead on to this recurrent implantation failure. So but most commonly the reasons can be attributed to the problems or the quality of the egg, or because of the quality of the sperm, or it can be even because of the poor quality of the embryos, or sometimes it is because of the maternal health or paternal health. So, but most commonly what we see is only a combination of factors that is causing this recurrent implantation failure problem. So, what are the tests that are done for recurrent implantation failure? So, it is important that we stop at this point and actually evaluate to identify if there are any reasons to correct this problem. So if not already done, it is important to do the following tests, like evaluate your thyroid function completely, and also do some of the special testing, like some of the tests to identify if there are any blood clotting problems, or some of the testing that tests for specific antibodies to check for the presence of any autoimmune problem. Or there are even tests to identify if there are problems in the uterus, like doing a 3-dimensional ultrasound or doing a procedure known as hysteroscopy. So all of these special testing will help us identify if there are any cause to treat before you proceed to your next cycle. Even for men, there is additional testing like sperm DNA fragmentation testing to identify the sperm health. So in addition to this, for some selected patients, there are some additional tests like checking the receptivity of your uterus, checking the microbiome environment of the uterus, and to check the local immune system. So these are all some optional testing. So what are the options that are given in your next cycle? The most important option to take is to consider pre-implantation genetic testing of the embryos. So this testing is done in order for us to select the good quality embryos that are having a normal genetic composition for transfer in your next cycle in order to improve the success rates. So when all this testing and all these treatments are going on, what you can do is you have to take measures to improve your well-being. So you have to take measures to maintain your body weight in the healthy range and avoid smoking, heavy alcohol consumption, and also you can take continue to take your folic acid and vitamin D supplementation. So recurrent implantation failure is a difficult problem to deal, and what we can do is correct all the existing problems, and also we have to take different approaches in your next embryo transfer, and eventually majority of the couple can conceive successfully.